Hello, I'm Dr. Michael Wach, foot and ankle specialist. I want to talk a little bit about ingrown toenails. Many people come to my clinic with ingrown toenails suffering. Sometimes they're infected with pus. It can be quite severe, but almost always they share the same thing in common. They're painful. So I wanted to talk a little bit about some of the things that you can do at home to hopefully prevent having to come into the doctor's office and get treated. And a couple of those things is how you cut your nails to begin with. I always recommend that you cut your nails straight across your toenails. Fingernails you can cut curved, you can cut into the corners on your fingernails, but on your toenails, it's really important that you cut them straight across, leave the corners long, and try not to cut your toenails too short. Oftentimes people have the bad habit of cutting them way too short, and that can cause an ingrown toenail. Also try to avoid tight shoes. Sometimes trauma can affect it, and oftentimes we can't avoid trauma. But one of the things that you can do is if you start to get a little bit of pain with the ingrown toenails, I always recommend Epsom salt soaks. That'll help to kind of calm things down. Now, if you get to the point where it just needs to be treated, it's too painful or it's infected and you need to come in our clinic, there are a couple of options that we can do. The most simple thing is to simply remove the side of the nail that is causing the problem. We do that under local anesthesia, so during the procedure you don't feel any pain at all, and we can do just one side or both sides depending on how many sides are affected. We put a dressing on it, and in 4 or 5 days you're healed up, you're doing great. Occasionally there might be a few hours of discomfort after the anesthesia wears off. Usually people don't miss any work, and it's not too bad. And so it's a much more simple, easy, and economic procedure to do. Now, if a person has had ingrown toenails over and over, there's a second option. And this is a permanent solution where 98 to 99% of the time, the ingrown toenail will never grow back again and will never cause problems. And you're pretty much cured for life. What we do is we remove the side or sides of the nail. But in addition to that, we actually take some special Q-tips and we dip them in acid, and with the acid we cauterize or burn the corners of the root so that the sides of the root will never grow back. It takes a little bit longer to heal, a little bit more expensive of a procedure, but the benefit is that you'll never have to worry about an ingrown toenail. So each one has their pluses and minuses. When you come into the office, I spend quite a bit of time, draw a picture. I want to make sure that every one of my patients fully understands the pros and pluses and minuses of every different option so that they can make the best educated decision. If you're suffering from an ingrown toenail, or if it's just you becoming too painful, give us a call. We're here to help. We're happy to get you so that you can feel much better. Thank you.